Thorax. This framework I call thorax. Actually, I'll call it marriage. Marriage of the thorax, aka cardio equals PULM. What do I mean by that? It's an idea that you probably already familiar with. Ooh, Sophie. Our dog doing the most. An idea that you could... It's basically different things that you have to pay attention to that once you learn the material, you already know them. But there's a difference between knowing them and remembering to think about them when you're not told to think about them. Yeah, so it's a difference between recognizing them when they come up, when you're told about them, and saying, oh, yeah, I know that, versus remembering to think about them when you're answering a question and these concepts are not actually explicitly brought up, but you just have to remember for yourself to think of that concept and consider how it might play into the situation. So this part I got down, this is the part I'm trying to work on, and that's what this framework is here to help me do. So it's basically the idea that the heart and lungs, the body parts or the organs that are in your thorax, are super interconnected. So I'll just start with some examples. You have the disease cor pulmonale, which literally means heart, lung. So cor means heart, and pulmonale means lung. This is when you get a heart disease that is caused by the lungs. So you see here that the word lung comes after the word heart. And so the lungs could back up onto the heart. Well, that's literally what is happening in the pathology as well. It's a problem where, let's say you have scarring of the lungs or something that makes it more difficult to pump blood through the lungs. Because of this disease that the lungs are having, that disease ends up backing up to the heart. And, it's literally blood that can't be pumped into the lungs because of whatever lung pathology is present. That blood is literally backing up into the heart. Just like the word has the lung backing up to the heart, since the lung part of the name comes after the heart part of the name. So I explained that whole name thing because even I myself forgot. Is this heart affecting lung or is this lung affecting heart? And it's lung affecting heart. So that little name trick helps. It's a lung problem backing up to the heart. That's cor pulmonale. That's one example of how they're so interconnected. What's another example? That's a path theme, right? Pathology. Let's give an example from another class, pharm. The example we have here is beta blockers. So beta blockers, if they're non-selective, they'll block beta 1 and beta 2. In other words, they'll act on the heart and on the lungs. And that's bad because we learned beta blocker. The first context I think, Brody, we learned beta blocker in is hypertension drug. You're trying to block these receptors on the heart to make your heart stop pumping so hard and so fast so that you won't have such high blood pressure. But if your patient has asthma and you give them a beta blocker that blocks both of the betas, both beta 1 and beta 2, acting on both the heart and the lungs, then that beta 2 receptor, when you block that on their lungs, it's going to cause their lungs to constrict. So it causes bronchoconstriction or bronchospasm, and then they can't breathe well. So you're basically giving them an asthma attack. So it's important to remember that you need to only use selective beta blockers, not non-selective ones, so that when you're treating hypertension, so that you can act on the heart without affecting the lungs. At least definitely in a person with asthma or something like that. So that's something where when I did a problem the other day It's been a while since we did the cardio farms, or our cardio section. So I didn't think about that at all. And I was just like, there's multiple beta blockers here. I don't see the difference. Why is one a better choice than the other? And I totally forgot about the whole selective, non-selective thing. If I had been using this, because it was a cardiovascular section that I'm doing, right? But I wasn't thinking about PULM because of that. But the whole point of this framework is that I should be thinking of them automatically. When I'm thinking of cardio, I should think of PULM as well, and vice versa, because they're both in the thorax, and they're both in this marriage of the thorax, and they're both super interconnected with each other. So those are just the two examples off the top of my head, but I know there's more because they come up here and there as you're going through the material in the M2 year. So that's something I want to keep in my mind now. When I think about the heart, think about the lungs too. They're just related. Cardiovascular, you're talking about clots and stuff, and then you talk about the pulmonary embolism. You're talking about cardiovascular, but it became pulmonary. So they're just so related. That's what I mean by cardiovascular equals PULM, the marriage of the thorax.